What's an educated mama?
Hello, I'm Ryan Jordan, and welcome to The Educated Mama. During this podcast, we will learn from experts, entrepreneurs, creators, and leaders who are also mothers responsible for all the things. Let's celebrate women, learn a few mom hacks, and discuss the beautiful mess of motherhood. We're all learning together, right? Today's guest is Bethany Warren. Beth is a psychotherapist in private practice in San Diego, California. She has a passion for reproductive mental health and has worked in this field for over 20 years. She is certified in EMDR therapy and perinatal mental health, specializing in perinatal mood and anxiety disorders, birth trauma, pregnancy loss, and infertility. Beth has worked in both hospital and outpatient psychiatric settings and has led several postpartum support groups for new mothers. Let's meet our guest. Hi, Beth. Thanks so much for joining us today.
I thank you so much for having me on. I really appreciate it. It's good to be here.
I'm really grateful to have you here today because I know that so many people who are listening will sigh a little bit of relief knowing that it's relatable that a lot of women are going through mental health disorders and just moments of challenging times right now. So I just want to jump in and talk to you about the topic of perinatal mood and anxiety disorders. Could you tell me exactly what these are?
Yeah, that's a great question. And I love that you're talking about it in relation to COVID, because you can think about this whole pandemic as like the great elevator or exacerbator, like it's just turned up the volume in whatever it was that you were dealing with previously. And when we're looking at perinatal mood and anxiety disorders, what the word perinatal means is anything related to conception and beyond. And so that deals with if you are trying to conceive and maybe struggling with infertility or fertility treatments, if you are currently pregnant, or if you are in the postpartum period and recovering, which really can be up to a couple of years after having your baby. So it's a really big encompassing umbrella term, which could mean any mood and anxiety symptoms that you might be experiencing throughout that period of time. We used to use the term postpartum depression, but have found that to be quite limiting because, first of all, postpartum means, of course, postpartum after having a baby, and depression means only depression, which, of course, parents aren't just experiencing depression symptoms. And often then parents weren't going to their provider and reporting what they were feeling if it was, let's say, during pregnancy, or if it was anything outside the realm of depression. And so the more education we can have around those words of perinatal and the fact that it's not just depression is more helpful. And the fact that it's parents too. It's not just the birthing parent, but it could also be the same-sex partner. It can be dads. All sorts of the family can be impacted by these disorders.
Let's talk about the differences in perinatal disorders. So I know that, some people, it was really talked about, postpartum depression. At the time when I had a child, that's what it was called. But looking back, I hear women talking about, no, I never had depression. I had more of anxiety. So can you tell me a little bit about the differences in those two?
Yeah. And I'm so glad that you're bringing that up. In fact, it's interesting that perinatal anxiety is actually more prevalent and more common than perinatal depression. About 1 out of 5 women will have or experience perinatal anxiety symptoms, whereas about 1 out of 7 women will experience perinatal depression symptoms, and about 1 out of 10 dads and same-sex partners will experience perinatal depression as well. And so it's way more common for women to experience anxiety. And so if you, for example, are having intrusive thoughts and worrying about your baby or your baby's health and experiencing that hypervigilance, checking your baby throughout the night, wondering, is she breathing? Is she breathing? or having intrusive images, picturing, dropping the baby over and over. And as a result, maybe not even feeling like you're capable of taking care of your baby, starting to avoid care of your baby, starting to avoid certain situations, starting to feel more and more paralyzed as a parent. That's not depression. And so if you're hearing that only postpartum depression exists and is treatable, but you're wondering what the hell is wrong with me, a lot of women were experiencing not only a shame spiral, but feeling like they couldn't bring that up to their provider because they thought maybe my provider is going to report me to the authorities, which, by the way, let me just say for anyone listening who is experiencing these intrusive thoughts or images, these do not equal intent. These are not the same thing as I want to do this or I want to harm my baby. These are super distressing and really, really hard, I know, for you, but they do not mean that that's what you want to do. And so it's important that you seek help with a trained clinician. We'll hopefully talk about that later, about where you can get help. But it isn't depression, right? And so this was keeping a lot of folks from getting help or from speaking up, the shame, this thought that something was wrong with them. And so it is helpful, I hope, for you to hear that there is a big difference between perinatal depression, perinatal anxiety. Women can be diagnosed with perinatal obsessive compulsive disorder and or even have some of the symptoms. Perinatal postpartum post-traumatic stress disorder can also happen after having a traumatic birth experience, after having trauma, even after a traumatic postpartum complication, for example. There can be trauma around nursing, can be very traumatic experiences, and so there can be trauma symptoms that can happen. There can even be perinatal bipolar symptoms and perinatal psychosis. And so none of these are the same as depression. And so it's good that we talk about the range of symptoms that can occur, all of which are treatable with help.
Mm. I love that you mentioned all of the variety of things that can happen to women after they give birth, because I know that many women, myself included, I had a traumatic birthing experience with my second child, and I didn't know that could be called like PTSD, right? Because I think of something else when I think of that, right? I feel like I would have to fight an war to experience something like that. And I think when you bring that up, I think it's really important because I know that a lot of women have an idea of the birth plan that they have in mind, they want to have, and then things go differently. So can we talk a little bit about that? So you have your birth plan, and it could be a variety of things. It could be you wanted to have a vaginal birth, you had a C-section, you had an emergency C-section, you had a baby come out not breathing, so there's things that can happen. And where do we go for help? I'd love to know, some of the options that when you do have a traumatic birthing experience, what are the first steps you can take and where can you go for help?
One of the places I would recommend you start is Postpartum Support International. The website is postpartum.net, and there is a whole directory there of providers who have specialties of infertility, pregnancy loss, perinatal mood and anxiety disorders, we call them PMADs for short, because it's kind of a mouthful, and birth trauma. The Birth Trauma Support Center is also another good one. And I can give you all the websites of these afterwards if you want, so that I'm not just rattling these off.
That would be wonderful. And I can post about those so people can know where to go for help.
Yes. And then there's a specific trauma therapy that I'm trained in called EMDR therapy. And then you can also go to the EMDR website, emdria.org, and find specific therapists who are trained in birth trauma as well. So I get happy to give you some other ideas, but it's just important to find someone who specializes in reproductive or birth trauma, just because this is a very specific niche, and it's important that you don't have to not only explain yourself to a provider who doesn't understand, but also isn't going to be frankly freaked out by your story. You don't want to have to feel like you're censoring yourself.
Sure, that's great. Now, I know that there's something called baby blues, right? That hormonal crash, as I call it. I remember having this after my first baby, just like it was 2 or 3 days where I was crying a lot. And then I was like, oh, okay, the adrenaline kicks in and motherhood kicks in. So what is the difference if somebody was having baby blues versus depression?
Such a cool question. And this is a really important question because this is oftentimes where well-meaning providers will inadvertently dismiss women's symptoms, and women will then go either unscreened or untreated for what actually is a perinatal mood and anxiety disorder. The baby blues really talks about just that 2 to 3 weeks at the most period of time of hormonal change after having a baby. I mean, when you think about it, having a baby is such an incredible time because it is such, I mean, first of all, it's an incredible thing, but also it is such a huge hormonal shift to go from pregnancy hormones to no pregnancy hormones. And then if you're nursing, to also nursing hormones. So it's a tremendous hormonal shift. And it would make sense that then it would have also an emotional shift as well with that hormonal shift. And so, oh, go ahead.
Yeah, I was just going to say also with having a C-section, I remember looking down and seeing staples in my body. I think I've never had a surgery, like a major surgery like that. So I think that's the other thing that people forget is like, yes, when you have a C-section, all of a sudden you look down, your ankles are like the size of watermelons. You've got sometimes staples or stitches or whatever they're using to stitch you up. And if you've never seen your body like that before, that can also be overwhelming. Like, whoa, I'm seeing my body in a different way that I never have.
Oh, for sure. And no matter how you delivered, your body has just gone through a tremendous process. Your sleep is completely disrupted. You might have a baby who's sleeping during the day, for example, and not at night. You're trying to figure out feeding. You are completely overwhelmed with becoming a parent. It is a tremendous period of time. I love that term matrescence that is being used to describe, it's like adolescence, but that description of becoming a mother, and that is truly a developmental life stage. And that as such, it would make sense that it's not going to be this overnight, like, I've got this, but really no wonder why it is such not only an emotional, hormonal, but also an emotional period of time. And it's important we don't pathologize that, and to just understand that, yeah, you're going to be tearful. Yeah, you're going to be joyful. Yeah, you're going to be terrified. Like all the things, all the things. But what is really frustrating to me is when the baby blues gets labeled or gets used when a woman is still experiencing daily tearfulness 9 months down the road, or if she is still terrified of, allowing anyone else to be involved with childcare or leave the house, 10 months down the road and has intrusive images of horrible stuff happening, or if she's experiencing that intense rage and feels like her emotions are out of control. Rage and irritability is a symptom that is often not discussed with PMEDs, but it's a really, really common one. And that is not baby blues. That is where there is something deeper at play. And so if someone just says like, oh, that's the baby blues. No, it is not. And that is important for us to then do a deeper dive and to screen this parent and to get him or her some additional help.
That's wonderful. Now, what if I am not struggling, but perhaps I have a friend, or a client? I, speak with moms every day, and sometimes I notice the signs or symptoms when somebody is struggling based on the things they say or the actions that they're doing. How might I help another woman in my life who is struggling?
I love this question because oftentimes it might not be ourselves that we're noticing, that's horrible grammar, but it might be the folks around us, our loved ones, who are like, something is up. And it's a nice question after this idea of baby blues, because it's kind of that idea of a continuum and how might we notice something is up. I always like to use the idea of duration intensity and frequency when helping people understand what's the difference between baby blues and something a bit more serious going on for both themselves and their loved ones. The idea of duration, how long has this been going on? And so it's a great question you can ask yourself, but also your loved one. Like, I noticed that you are more anxious than my normal girlfriend would be, like, or I noticed that you're having a difficult time leaving the house, and it's been now, well, that's not a great question during COVID, right?
Yeah.
but in difficult.
We all have this now. COVID made all of us traumatized.
I know, stepping out of our bunkers like, but some of these more usual behaviors someone might have had no problem with, like maybe the duration is now like it's been months and months. And so duration, I find, is a really useful one. Like, how long has this been going on for you? And then intensity is a great question too. Of course, you don't have to use these specific words, but more just the question of intensity. It's that idea of like, every mom cries, or every mom is anxious. Every parent gets worried. How intense is this for you? Is it so intense? In other words, is it so cranked up in intensity that it's tough for you to do some of your daily life? Is it tough for you? Is it getting in your way of eating? Is it tough for you? Is it getting in your way of like socializing with others? Or mainly, this is a biggie, is it disrupting your sleep? When the baby is sleeping at night, is it really tough for your brain to shut off and for you to go back to sleep? Or is your body so wired it's tough for you to get back to sleep? Those kinds of things. And then frequency, that idea of how often is this happening? So again, that idea of like, every mom cries, every new parent is exhausted and gets irritable. Frequency, though, how often is it happening? Is it happening so often through the day that it would be hard for you to remember the last time you actually were joyful? Would it be hard for you to remember the last time that you did actually feel at peace and safe in your body? Would it be hard for you to remember the last time you did get a restful chunk of time of sleep in between the baby's sleep? So sometimes these questions can be helpful as you're sitting with a girlfriend or a loved one. And or just that gentle way of saying, I love you, and I'm noticing something is different, and I'd love to be here with you and help you. And this is what I'm noticing. How can I help you? This is what I would suggest, is that we get you back with your doctor, or that we get you in with a therapist. Can I help you with that? That kind of thing. It depends, of course, on how close you are with this person. That might feel super intrusive and not wanted, but at least, tailoring your conversation around that duration, intensity, frequency, I have found to be a useful starter.
Those are great tips to just kind of gently, approach the topic, because I think a lot of people have shame surrounding these topics. They think it's what's wrong with me, when it is really common. And I think that the more we talk about this, the more people will feel vulnerable and comfortable to talk about it, because these topics are so important. And as you said, 34% of women, that's a lot of women going through this. Now, I know you said same-sex partners and dads can also go through this. So tell me a little bit more about that.
Yeah, first, I just want to jump on what you were saying. Absolutely. There is no shame in this, even though a lot of shame is felt. There is, if for anybody listening who is experiencing this, please hear me. There is literally nothing that you did to cause this. And I know you may be struggling with that, wondering, who am I as a parent, that either I'm not enjoying this experience, or I love my baby so much, but it is terrifying. And being a parent, and this is just so much harder than I thought it would be. This is not your fault. This is not your fault, and it will change. It will get better if we get you some help. And so it's important to hear that. So I love that you brought that up. But yeah, to shift gears to partners, very, very common in partners. It's about 1 in 10 dads, and we're still needing way more research in the LGBTQ community, but we do see a higher incidence with lesbian moms, and we do see a higher impact on that community. And so it can very much impact partners as well. And unfortunately, partners often get ignored, and or there's a lot of pressure, for example, on dads to be the support. And so people are often looking to dads to be the support person, and you need to be taking care of mom. And especially during COVID, this has been such a tough thing where maybe the couple has been cut off and isolated from the rest of their support because people couldn't safely come into their house, and or maybe they didn't feel safe hiring a doula, and or maybe they couldn't hire a doula because doulas weren't able to go into most hospitals for a period of time, or they weren't able to get the meal train that they typically would, yada, yada. And so a lot of times they were just looking to each other for support and rescuing. And if one or both of the couple were struggling and suffering, then I always use the analogy, it's like two people just trying to tread water and then just passing a baby back and forth. And you can only do that for so long. That just has become really, really tough. So yes, partners can really struggle too, and actually have these true mood and anxiety disorders that require treatment. So we also need to keep screening dads and partners as well.
Good to know. That's really good to know. And just think about the other person in your life. A lot of times when you're struggling, it's hard to imagine, the other person struggling because they didn't give birth, or they're not always needed, or they're not breastfeeding, or their body is, not being needed as much. But it's a really good reminder for all of us to take a look at our partners and just know that we're both in this together, navigating this as best as we can. I want to touch upon a subject that I was just enlightened upon about 4 years ago. And now that it's come to light more, I think it's really important to touch upon it. And it's the disparity of miscarriage and care for women of color versus white women. And I want to talk to you about this, Beth. Tell me about your experiences with this and why you think there are such disparities for women of color and dealing with birth and experiences.
I'm so glad you're bringing this up. And I also, just want to recognize that we're two white cisgender women talking about this. And it's important that we, use our voices and highlight this, and also that we amplify the melanated voices that are doing this work and organizations that are doing the work to course correct on this. But yeah, unfortunately, women of color do face a huge disparity in PMADs, in maternal mortality rates, in infant mortality rates, in infertility rates, and in pregnancy loss rates. And so it is across the board, across socioeconomic lines. So even, for example, when you're controlling socioeconomic status, women of color will, have higher maternal mortality rates, and they will experience higher rates of PMADs. And one of the biggest reasons for that, of course, there's a multitude, but one of the biggest reasons is implicit bias among providers. So an example of women of color having higher rates of perinatal mood and anxiety disorders is they're not often screened as often, or they're not as screened as often, and then not referred to treatment as often, or there's not treatment as readily available. And so there's a huge lack of awareness around this, huge lack of resources, and a huge lack of training for providers. So the good news is there is more of a spotlight on this now, and there is more of a movement, and especially a social justice movement. And there are a lot of great organizations who are paying attention to this for equitable care and for equitable treatment. And so again, at the end, I'd be happy to share with you some good organizations to follow and to donate to, and especially if you're a woman of color, to know where some good organizations to help, support you in terms of doula care, in terms of perinatal mental health care, et cetera.
Thank you. I would love those resources. And even if I can tag them in our Instagram when we post your episode, Beth, so that people do have resources that they can donate to. I know that we as an organization have donated. And so I just think it's really important to bring awareness and bring light to this subject. So thank you so much. Yeah. And Beth, I heard you wrote a book.
I did. Yes, my colleague who also, her name is Beth, Dr. Beth Kriegerberger. She and I wrote a book. It's been our little book baby. We have been writing it for about 4.5 years, and it's due out in the fall. So I'm so excited. I can't wait till it's out there. It's called the Pregnancy and Postpartum Mood Workbook. And it is exactly about all these topics we just talked about. And we really wanted to make sure that we had a workbook that was accessible and talking about all of these mood symptoms. There are a great number of really, really good books out there addressing perinatal depression, for example, perinatal anxiety, et cetera. But what we found is that there weren't a great number of books that were addressing all the different mood symptoms that a woman can experience or a birthing parent could experience during their pregnancy or postpartum journey, and or that they didn't often include birthing partners. And we also wanted it in a workbook format so that when you're a sleep-deprived parent and your attention span is like that you could go and just get a little bit of information and then a little bit of a skill building exercise, a little bit of information, little skill building exercise. We have stories all throughout so that you can see that you're not alone and you can relate to other people and their experiences. So I can't wait till it's out. It's been a long time in coming.
I know you've spent the last 20 years of your life focusing on this, and I'm just so excited that, you have a book that's coming to fruition. Beth, is there anything else that you would like to touch upon with our listeners before we say goodbye?
I don't think so, other than to just remind you that truly, if you're suffering right now, if you're experiencing anything that we talked about, you are not alone. As you're hearing 1 in 5, 1 in 7, 1 in 10, all of these numbers hopefully reassure you are not alone. And I always like to say to my clients, the 2 big T's, this is temporary and treatable. And you will get better. It's just important to get help and to find help that is a good fit for you. The one weird blessing with the pandemic right now has been most of us mental health clinicians are offering teletherapy virtually. And so whatever state you're in, you can see anyone within your state. And so what is cool about that is then it broadens the ability to see a specialist who doesn't have to be right down the street from you. And so I just encourage you, when you are looking for help, that even though a lot of folks right now are more full because a lot of people are really struggling, please don't give up. You deserve help and you will get better.
Thank you so much, Beth. I truly appreciate all of your solid advice, and thanks for coming onto the show today.
Thank you. Thank you for having me.
Thanks so much for listening today. I hope you enjoyed this week's episode and you had some great aha moments. I am so passionate about empowering women, and I can't thank you enough for your support. If you know an inspiring mama or you are an inspiring mama, send them our way. Be sure to tune in every Wednesday, and please like, follow, and subscribe to The Educated Mama. Write a review, leave us a comment, share this podcast with your friends. I'm Ryan Jordan, founder and CEO of Educated Nannies. You got this, mama.